In the vast stretches of rural America, where rolling hills meet endless plains, critical access hospitals are the lifelines of these communities. But in recent years, their future has been anything but certain. This white paper by University of Phoenix raises an important question. Are critical access hospitals in critical condition? This is Research Rising. These hospitals are more than just medical facilities. They provide essential 24-hour emergency care to the nearly 20% of the U.S. population living in rural areas. They are economic hubs, often the largest employers in their regions, but a staggering trend threatens to unravel this safety net. From 2005 to 2023, 192 rural hospitals shut their doors. Behind these closures lie three main challenges: financial instability, population decline, and a severe shortage of healthcare professionals. Many of these hospitals operate on razor-thin margins, relying heavily on reimbursements from Medicare and Medicaid. A single economic disruption can tip the scales. But what makes these medical centers critical access hospitals, CAHs? By their state government, they must meet specific criteria. Be located in a rural area or an area classified as rural. Be at least 35 miles away from the nearest hospital. Have a maximum of 25 inpatient beds. Maintain an average patient stay of 96 hours or less for acute care. Provide a 24/7 emergency department. This designation helps ensure access to healthcare in remote communities. Meanwhile, rural populations are shrinking and aging. Older residents often have more complex healthcare needs, placing further strain on these facilities. A recent study focused on 20 critical access hospitals in Illinois offers a closer look at the challenges and resilience of these facilities. Financially, these hospitals showed resilience. Revenues increased by an average of 29%, outpacing a 26% rise in expenses. Profit margins improved overall, with only 3 hospitals reporting slight losses in 2022. One way these hospitals have adapted is by shifting their focus to outpatient care. On average, outpatient services accounted for 83% of total patient revenue in 2022, compared to just 53% for hospitals statewide. But one critical area remains underserved: behavioral health. Rural communities face significant gaps in mental health services, with fewer specialized providers and limited access to care. Establishing rural community health centers that integrate primary care with behavioral health services could be a game changer. Illinois' critical access hospitals demonstrate that with adaptability and innovation, survival is possible. But sustaining this progress will require a multifaceted approach. By focusing on these priorities, critical access hospitals can continue to be the backbone of rural healthcare. While the challenges are immense, the resilience of these hospitals and their communities